Hey guys, Concussion Doc here, Dr. Cameron Marshall, founder and president of Complete Concussion Management. Welcome to the CCMI training course for PTs, DCs, ATs, OTs. This course is specifically designed for rehabilitation professionals who are either interested in entering the concussion management and rehabilitation space, or for those who are already treating concussion patients but just want to up their game. As I mentioned before, my name is Dr. Cameron Marshall, founder and president of Complete Concussion Management. I'm a published concussion researcher and a practicing clinician who's been specializing in the field of managing and treating patients with concussions for about 10 years now. You may have seen me on Instagram or YouTube as Concussion Doc, or you may have heard me on my podcast, Ask Concussion Doc. Regardless of how you got here, you are here with me now, and I'm super excited to share this training course with you. As a rehab professional, it is extremely important to understand that appropriate concussion management must include a heavy involvement of you. You are concussion care. From baseline testing to initial management to return to learn, work, and play, the evidence supports early intervention and rehabilitation for concussed patients. In fact, the majority of effective treatments for acute and chronic concussions are rehab and manual therapy. Not only do you have a unique skill set to help these patients, but this can and will be a huge referral generator for your practice. You just need to know how to correctly apply these skills based on the up-to-date scientific evidence so that you can do it appropriately. Well, this is exactly what this course delivers. There are many courses out there, from vestibular courses to functional neurology courses to balance rehab to little 1-hour online modules and weekend seminars where you get a bunch of different speakers providing surface level knowledge on their particular field of expertise. But this is the only course that takes all of those courses and puts it all together in a systematic way that compiles all the evidence into clinically applicable algorithms and start to finish management strategies for every kind of concussion patient that you may come across. This 9-week, 40-hour course is everything you need to know about concussion. Everything from the pathophysiology to biomechanics, implications for the cervical spine, international consensus statements, sideline, on-field management. What are the most evidence-based baseline tests? How to run them, score them, and use them for making better return to sport decisions. Concussion assessment and diagnosis, evidence-based protocols for returning people back to school, work, sports, life, assessment, treatment, and the rehabilitation of chronic post-concussion symptoms. These are the most challenging cases that you will see. But once you learn what's really going on and how to properly assess, you won't have a problem anymore. The goal of the CCMI training program is to make you an expert in the field of concussion. Just click on the green button to get started and to get immediate access to what has become known as the best concussion course available anywhere in the world. I'm so confident that you will love this course that we give everyone a 14-day money-back guarantee. If you don't completely fall in love with this course within the first 2 weeks, I'll give you a full refund. And if you're from the United States, you also have the option to use PayPal credit, where you don't need to even pay for 6 months and there's no interest attached to it. So you can basically buy this course, finish this course, and start seeing concussion patients before you even have to pay a cent. So if you choose to level up your concussion game with Complete Concussion Management, here is what you're going to be in store for. Over the next 60 days, we are going to dive deep into the pathophysiology of acute concussion injuries, from what happens inside the brain from the incident of impact for the first few weeks after the injury. This module will provide you with tremendous insights into the mechanisms of concussion, which will lead nicely into Module 3, where we cover the pharmacological and natural dietary and supplemental interventions which can act directly on some of these pathophysiological mechanisms. Module 3 is taught by Dr. Paul Herkel. If you don't know who he is, you're going to become quite familiar with his genius. Be sure to check him out on social media at Dr. Paul Herkel. Module number 4 then gets into the biomechanics of concussion. How much force does it take to get a concussion? What's worse, linear or rotational forces? How can protective equipment help? What are the implications for the cervical spine? Do neck strengthening programs have a role to play? How do males and females differ? and much more topics covered in this particular module. In Module 5, we get into baseline concussion testing. Many people consider computerized testing to be the same thing as a proper baseline. This could not be farther from the truth. Computerized testing is but one small component of what a proper baseline test should include. What tests should you include? How are they done properly? How are they scored? How much change is acceptable? This is a key module for anyone who's going to be working with athletes in any capacity. Module 6 is all about the impact test. The impact test is a computerized neurocognitive test and is probably the most heavily researched computerized neurocognitive test available. Although it has not been found to be effective as a standalone tool, research that's been done looking at it as part of a comprehensive battery has found that it can be a very important addition to a proper concussion management strategy. In this module, we cover how the test is administered, how it's interpreted, and how it's used to make safer return to sport decisions, and also how it can help provide some cognitive insights. Module number 7, we get into the assessment and diagnosis of acute concussion. This module literally has it all. It covers everything from on-field evaluation of an unconscious patient and is emergency first response. We also cover sideline evaluations and then all the way to clinical evaluations. This module covers red flag scenarios, neurological examinations, and when to order imaging or additional testing. Once you've made the diagnosis of concussion, you get into Module 8, which talks about how to get a patient back to school, back to work. What's the difference between office workers versus labor workers? It's a completely different process, and we get into both scenarios. We get people back to driving. How do we properly return someone back to driving, which is a huge part of everyday life? How do we get them back into physical activity and back into a full contact sport? This module also covers the Buffalo Concussion Treadmill Test and a special test called the Chicago Blackhawks Test, as well as how to re-administer baseline testing, and again, what type of change in those scores is considered acceptable. Also, how do you return an athlete back to sport when you don't have a baseline test? Module number 9 gets into the pathophysiology of post-concussion syndrome. Why do some people recover quickly and others take months or even years to get better? What are the mechanisms involved? What's the pathophysiologic process? This module sets the tone for an effective evidence-based treatment program that is covered in a jam-packed module number 10, which is the treatment of PCS. This 8-hour module covers off how to assess every single possible PCS trajectory, how to rule things in, how to rule them out, and then what to do about it. It covers everything from autonomic dysregulation and blood flow issues, how to deal with orthostatic intolerances, visual disturbances and ocular motor dysfunctions, vestibular assessment and rehabilitation, assessment and treatment of the cervical spine, hormones, psychology, and most importantly, when to refer and who to refer them to. Module 11 is a super interesting and in-depth take on chronic traumatic encephalopathy, CTE for short. This module always blows people's minds. What do we really know about this condition? What causes it? Do we really know as much as the media would have you believe that we know about this topic? It's not as straightforward as you would believe. And finally, in Module 12, we discuss how to use your newfound knowledge to get a program set up and running at your clinic. We also cover off more information about how to join the CCMI network for those who are interested in taking advantage of all that we have to offer, including the tools, the technology, the apps, the database systems, the resources, the testing, the marketing, and those who are interested in taking their program to the next level will get more information on that. So I hope that you are excited as I am for the next 8.5 weeks or so. This course is designed to make you an expert in the area of concussion so that you can gain the skills and confidence to manage any patient that walks through your door. This program will also allow you to work with local sports clubs and gain access to more patients through sports partnerships, comprehensive baseline testing, and acute injury management. I literally built my entire practice by partnering with just a few local sports clubs and doing all of their concussion testing and all of their acute injury management. Because after you see the patient for concussion or even for their baseline test, They know who you are. You've interacted with them, and now they're back in for their ankles and their shoulders and whatever other injury that may occur. You've seen some testimonials along the way, and if you're still not convinced, I have a few more for you. Franco says complete concussion management is one of the best courses I've taken, evidence-based, practical, and extremely thorough. This is somebody inside the course. Hi, Cameron. I'm absolutely loving the course. Great delivery of information, great evidence to back up the rationale. Thanks. Dr. Mark Maloney, complete concussion management has provided me with the tools to be an effective team doctor, working on and off the field with multiple sports programs and associations. Dr. Maloney works with a number of football organizations at a very, very high level. Julie Fisher says, it is amazing to answer a phone call from a terrified fellow parent after the child has sustained a concussion and be able to confidently reassure them that they have made the right call, and our physiotherapist will be able to get their child back to 100%. Dr. Scott Christie, the Complete Concussion Management Program, continues to lead the way in the education and management of concussions, and we are very fortunate to be contributing healthcare clinics to the implementation of this forward-leaning program. This is a guy that took the course, and I messaged him on Instagram asking how he liked it, and here's what's his response. Would have done it all over again if I could. It was amazing learning everything I thought was accurate about concussions turned out being not. I really think more docs need to do it for the information, even just on headaches and whiplash and car accidents. I loved it all and really appreciate everything you've done. Thank you so much. And finally, Mr. Darren Cohen says, commit to this and you'll realize in 1 year how much more valuable your service is to your community.